amazing people in reproductive health across the United States and Canada. I'm Griffin Jones. This is the EIVF conference going on right now in Dallas. We're going to talk about HIPAA today, and I have a guest on the show. I brought on an attorney that specializes in HIPAA. Mike Bossenbrook is with the firm Walkler. And Mike, if someone's looking for your services, where would they find you?
Sure. Thanks, Griffin. My name again, Mike Bossenbrook. I work at Walkler and Associates. You can find us on the internet, www.walkler.com, WACHLER. We also have phone numbers. You can call us at 248-544-0888, but we have a very prominent website and blog presence, so we post a lot on HIPAA as well, so you can catch us there. Definitely, it makes sense for a provider to consider, any as part of their sort of portfolio of policies and practices, if they're going to have a social media presence, how their employees are to handle that. If they're going to be engaging in it, accessing it, communicating with it, what are the rules around that for within the organization? You find that, for example, there's concerns about patients having their information that should potentially be part of an electronic medical record, for example, being somehow found in social media channels, which is not helpful for an organization trying to keep all the patient files and patient information in one source. But generally, I think it's a good idea for like you said, not to sort of jump into it without a thought process behind it, but for providers to think about if they're going to be in social media, whatever platform they're thinking about, whether it's Facebook or if they're going to have a website with a blog, if they're going to have a Twitter account, to think about who's going to have access to it, what employees have access to it, what can they do with it, what sort of communications are they allowed to engage in through that. And I think to your other point, on the flip side, if you're allowing the public to have access to some of your social media and interact, whether say a comment box, or if you have a blog that allows responses, things like that, what kind of expectations can they have about information they're potentially putting on your social media? Putting them on notice that they there's maybe going to be a monitoring of comments, or there's going to be certain information that is not going to be allowed to post, and it's going to be directed to different channels. So those are things that I think a provider really wants to think carefully about before they launch into social media.